It's a privilege to be on this platform being hosted by Reverend Elijah and his wonderful wife, Bethel of Praise Christ Ministry. The Lord continue to bless you and honor you. Tony and I are general practitioners in Walthamstow. I'm also a pastor in Living Faith Ministry, but I'm not here on that assignment tonight. The assignment we have is for us to fellowship together and to be receive information that will make us be guided in our decisions regarding COVID and COVID vaccine. So Tony will be starting us off on the talk, and I hand over to her. Tony. You are muted.
Good evening, everyone. Can you hear me?
Yes.
Yes. Good evening.
Yes.
Good evening.
Thank you to the hosts of this event and to every participant. Thank you for having myself and my husband on today. And my prayer is at the end of the day, we will be more informed in various dimensions to make the right decision regarding COVID-19 vaccination. So I've started sharing my screen. Can you see it?
Yes.
Yes, okay, thank you. So it's working this time. So COVID-19 vaccine. As my husband said, we're both general practitioners. And I've also worked in the field of public health medicine. And I've done that for the last about 17 years in total, public health medicine, as well as being a general practitioner. So when we're talking about infectious diseases and prevention, that's really an area I'm quite involved and passionate about. So today we're talking about COVID-19. And I know I've sort of presented this presentation somewhere else before, but I think it's just important to remind us of some important dates. And today, incidentally, happens to be, I don't know if anniversary is the right word to use, but today marks 1 year when the UK first went into lockdown because of this disease called COVID-19. And to date, 126,872 people in the UK have succumbed to this disease. This disease is still amongst us. This is the second spring. You know, when it was mentioned last year, when the lockdown was instituted last year, we didn't think we'll still be here 1 year after. But I just want to seek our indulgence that, you see, those 126,872 people were someone's mother, sister, brother, aunt, whatever it is. And I'd like to indulge us just to take a minute's silence, just to reflect and remember those who have departed and their families that they left behind. So I will just start the timing now. I've got a timer on my phone, just 1 minute silence, please, in remembrance of those who succumbed to this illness. Thank you. So we just move on with the presentation. So as I said, 1 year of lockdown, But actually, the whole problem with COVID came to the awareness of the world in December 2019. Well, it came to the awareness of the WHO because there was a city in China called Wuhan who notified the WHO that people were dying from a pneumonia. They didn't know what had caused the pneumonia, and they notified the WHO. Anyway, in January 2020, WHO decided to declared a public health emergency. And moving forward, by March 2020, the WHO had formally declared the COVID-19 pandemic. And the rest, as I say, is history, because we are still in the pandemic and it's affected virtually all the nations of the earth as we know it. To date, so we've had 3 lockdowns. We're in the midst of the 3rd lockdown in the UK. The 3rd lockdown started on the 6th of January. And I know sometime in February, the Prime Minister then has sort of done a roadmap to see how we will come out of the lockdown. But nevertheless, the point is that the battle against COVID-19 is still on. So before we can talk about the vaccine, it's just important that we remind ourselves one more time about the COVID-19 itself, just a brief overview. I won't go into too much detail, but just a brief overview. So COVID-19, as we've come to understand, is a potentially severe acute respiratory infection. The disease itself is known as COVID-19, and that's shortened from coronavirus disease. And because it was detected in 2019, that's why we have the 19 at the back of it. So the disease, the official name is COVID-19 disease. And the virus that causes it is a virus called the Severe Acute Respiratory Syndrome, Corona-2 virus. And that's a mouthful, so we shorten it to SARS-CoV-2 virus. And yes, so the presentation, it can be a mild illness, almost like the common cold, with a fever and all that. Or as we've come to understand, it can be a severe viral pneumonia. People can end up in hospital for a long time, and unfortunately, people die from it. So the characteristic symptoms for those who suffer the mild illness are things like fever, cough, breathlessness, a loss of taste and a loss of smell. Although we do have to take on board that a lot of people were infected with COVID-19 and showed no symptoms whatsoever. And these people caused quite a big public health problem because they don't have symptoms. They're going around and passing the illness on to other people through no fault of theirs, because they didn't even realize they were infected in the first place. The more severe complications, which death, we can't overstate that. Other things like multi-organ failure and all sorts of complications. People are in hospital for a long period of illness and rehabilitation after they've been discharged home. You have some people who have a syndrome, which we've just found out about more recently, called long COVID. So a lot of these people are not necessarily admitted in the hospital or anything, but they can't seem to recover. They're not quite back to themselves, and they keep having this COVID symptoms, sometimes up to 3 months after having the infection. So how do we manage, how do we tackle the scourge of COVID-19? Well, so we talk about treatment. So for those with mild illness, it's home management. And we've heard of, people being unwell, we advise them, stay at home, rest, isolate. If they've got a fever, use, things like paracetamol or ibuprofen. But for those who are more unwell, they might have to be taken into hospital and admitted and have much more radical treatment depending on the severity of the illness in them. But the mainstay really is trying to prevent it in the first instance. And so when COVID-19 came onto us last year, we've had a whole new lifestyle of living. So sanitation, hand washing, constant hand washing, maintaining a safe distance. And before I go into that, why are we talking about this? Because the way it's transmitted, COVID-19 is transmitted through air droplets, either through people coughing or sneezing. And sometimes these things can, when they cough out the droplets, which is infected, this can also go on surfaces. So when we talk about hand washing, because you touch all sorts of things, touch wherever it is you touch, eventually our hands always get to our face. So to avoid that transmission, we advise to always wash our hands where possible or use sanitizers. Maintaining a safe distance called social distancing, avoiding crowded places. wearing face coverings or face masks. For those who, like for doctors, nurses, healthcare workers, wearing protective, all sorts of protective gear, the visors, face masks, protective clothing. Of course, the more radical things include things like the various degrees of lockdown measures that we've experienced in the UK and up and down the world. And the final thing is around vaccination, which is really the cornerstone of our talk today. So in terms of the vaccination, we have to understand a little bit about the virus before we can understand how the vaccine itself works. So as I mentioned earlier, COVID-19 is caused by a virus called the SARS-CoV-2 virus. And the SARS-CoV-2 virus comes from a family of viruses called coronaviruses. And some of them have been infecting human beings forever and cause mild illnesses like the common cold that we have every now and then is caused by a coronavirus. But unfortunately, some coronaviruses can cause severe disease. And the first we became aware of the severe disease caused by the coronavirus was when we had the SARS-CoV-1 virus. So now what we're talking about is the SARS-CoV-2, but there was actually a SARS-CoV-1 virus in 2003. It affected mainly people from Asia, China, Japan and places like that. So again, as I said, I've worked in public health for a long time, and that's why I was aware of it, but most of it was confined to that part of the world. And it's interesting, I'm sure a lot of you will have noticed that when you see people from these regions, even when they're here in the UK, long before the COVID-19 scenario, they always appear with face masks. And I believe a lot of this was because of their experience with SARS-CoV-1 many years ago. Then after that, we had another serious illness caused by the coronaviruses, and that was the MERS COVID virus, and that was in 2012. This time, the MERS refers to Middle East respiratory syndrome. So this affected people mainly in the Middle East, and Saudi Arabia had the highest number of cases. And in actual fact, they haven't still been able to eliminate it completely, so it's still a problem in those areas of the world. Fast forward to 2019, the next of this family of viruses is the SARS-CoV-2 virus, which causes COVID-19 as we are aware of today. So the SARS-CoV-2 virus, I've tried to put a picture there. So it's got lots of spikes on it. You've got this circular virus and it's got lots of spikes. And I don't know if any of you, there have been lots of pictures in the media, maybe in the media and in health media sort of thing. So you've got all these spikes around it, and it says these spikes make it look like a crown, hence the name coronavirus. There are two types of viruses, RNA and DNA viruses, but the SARS-CoV-2 virus is an RNA virus. It's an RNA virus. It doesn't go into the human DNA. And the vaccine that we create from this virus also does not go into the DNA of human beings. Now, I just want to remind us of how vaccines work, and then we go back to the virus. Vaccines, basically what they do is they teach your immune system to create antibodies. And you can view antibodies as soldiers, the natural defense soldiers. So these antibodies help to protect you from disease. So what we try and do with the vaccine is that we introduce something into your body that allows your body to create antibodies so that when you are now faced with the real illness itself, these antibodies can fight on your behalf and mount a defense against the infection. And it's much safer to get immunity by having a vaccine than by being exposed to the actual illness itself. Because we know, for instance, with COVID-19, it can cause death. Why risk being infected by it and dying when you can use a vaccine that will also protect you against the illness? So in the case of this virus, the SARS-CoV-2 virus, as I said earlier, there are lots of spikes in that earlier picture that I showed. There are lots of spikes coming off this round body. This is known as a spike protein. This spike protein is what causes the body to mount an immune response, or rather you could say this spike protein is what causes the body to develop antibodies. So the spike protein, how do you then get it into the human body? Well, we get it into the human body by the various vaccines that have been developed today.